your provider today. I'll be doing an examination of your chest, your lungs, and your heart. Is that okay with you?
Yes, ma'am.
Okay, I just need to put some sanitizer on my hands. Washed them already, but I wanted to put some sanitizer on.
Okay.
So the first thing that I'll be doing, Mr. Harris, I'm just gonna be looking at your face. Right now, I'm just looking to make sure that you don't have any obvious signs of distress. And I don't see any. I don't see where you're using any accessory muscles. I'm listening for any wheezing. I don't hear any audible wheezing or stridor. I'm looking at your face to see the color. I don't see any blueness or blueness around your lips. If you would, can you open up your mouth for me? Okay, and right now I'm just checking for your dentation. You can close it. And normally if your oral hygiene is not as good, that could be an indication of bacteria and colitis, okay? Okay, so right now I'm just looking at your precordial area here. I'm just checking your chest. I'm looking for any scarring, open areas on your chest, and wounds. Okay, I'm just gonna go eye level. And when I go eye level, Mr. Harris, I'm just looking for any heaves or any thrills, things that I shouldn't be able to, or lifts, I'm sorry, things I shouldn't be able to see with the eyes, and the pulsations, okay? And everything looks good there. Then I'm gonna look here for your PMI. It's gonna be right over here by the apex of your heart. It's in the fifth intercostal space, mid-clavicular line. And I'm just gonna shine the light here to see if we can actually see the pulsation from the light. Okay. All right. Now we're gonna feel for the PMI. And like I said, it's in the fifth intercostal space. So that's the second. This is the third, fourth. This would be your fifth. And we'll just go over just a little bit. And that should be your PMI right here. And it is. It's nice and bounding. I can feel it. All right. Then what I'm gonna do, I'm gonna get you to turn your head to the left side. I'm just looking at your jugular vein here, and I'm looking for any distension. I don't see any actual distension. Look at the light. Then I'm gonna check your carotid pulse. If you just hold your head back over on that side for me. I'm gonna check your carotid pulse. Nice and bounding. Okay, if you'll turn to the other side for me. No distension is noted on this side either. Nice and bound and equal on both sides. Plus 2 pulses. I'm just gonna leave this light on and let me know if it bothers you, okay? Right now I'm just gonna touch your skin and you feel real nice and warm, nice pink color, symmetrical chest from what I can see here. And now I'm just gonna note some little landmarks. If you would hold your head up for me, and I'm looking at your trachea. We just wanna make sure that it's in line, there's no deviation. Your suprasternal notch is right here and below. And then if we go down a little bit, we have the mandible, and then your angle of Louis, and then your sternum. Okay? Over here on by the fourth intercostal space, that'll be your sternal border. Okay? All right, and then of course, like I said, this is gonna be where your apex of your heart is, where your PMI is located. Your axilla is over here on your left side and your right. All right. So now I'm just gonna listen to your heart.
Okay.
We'll go down to the second intercostal space. This is your aortic valve on this side. We'll listen with the diaphragm of the stethoscope.
Okay.
Lub dub, S1 and 2. Good deal. Go to the left of the sternal borderline and the clavicular line. And this is the pulmonic valve. Lub dub, S1 and 2. Now we'll go to the third intercostal space. That's your Erb's point. And this is where you'll hear the S2 the loudest. Let's see, the fourth intercostal space is the tricuspid. Lub dub, 1 and 2. Then your fifth intercostal space, again, that's where your PMI is located. Okay, Mr. Harris, we're gonna go over those same landmarks, but this time I'm gonna listen with the diaphragm, the bell of the stethoscope. because with the dial of the stethoscope, I'm able to hear if you have any murmurs. Okay. I'm gonna put more because on this side. First point. I'm gonna try close to your head. And then back down to your fifth intercostal space where your PMI is located. I don't hear any swishing. I don't hear any gallops or rubs or anything like that, okay? Okay, so the next thing we're gonna do is we're gonna listen to your lung sounds, okay? So on this side of your chest, this is gonna be the right side. You have 3 lobes. You have an upper, a middle, and a lower. And on the left side of your chest, you only have an upper and a lower, okay? So we're gonna just take a listen to those. Let's listen to the right side. Okay, and you go back here. Nice deep breath for me. Good. On this side. Mm-hmm. I'm gonna listen over here and be like, Zilla, if you hold your arm out, son. There you go. Deep breath for me. Alright, let's come back on this side. And we'll listen here. Okay. Inhale. And we'll listen, we're trying to feel to make sure we're not feeling any thrills, any buoys, and I don't feel anything. Okay, so let me get you to sit up for me, Mr. Harris. If you would just kind of bend over with your arms crossed in front of you. And again, I'm just looking for symmetry right now, just making sure that your anterior and posterior chest are symmetrical and they are you're nice and warm and pink. Okay, you don't have any barreling. Alright, I'm gonna check for your chest expansion. And I'm just gonna pull in right here, Mr. Harris. If you would just take a deep breath in and out for me. Good. Okay. Now I wanna listen to your lung sounds. I'm gonna listen here with the diaphragm. I'm listening with the for the apex of the lungs right now. Deep in and out. Good. Let's go nice and slow for a minute. All right, in and out again. Okay. Okay. In and out for me. Good. In and out. Good. And on this side, in and out for me. Okay. Now, Mr. Harris, I'm gonna check here, and I just want you to say the word 99.
99.
Say it again, 99.
99.
Again.
99.
Again.
99.
Again.
99.
Again.
99.
One more time.
99.
Okay. All Alright, so the next thing I need to do is I want to check your diaphragm of excursion, okay? So I'm gonna need for you to take a deep breath and I want you to hold it for me, okay?
Okay.
Okay, you can let it go. Okay, Mr. Harris, I'm gonna need you to do that one more time for me. Take a deep breath in. Okay, so when you check in your diaphragm of excursion, what that does is just telling me how far your diaphragm is going down when you're taking a deep breath, okay? And it looks like, just from the measurements here, it looks like it's gonna be about 5 centimeters, okay? All right, now I'm just gonna measure. And I'm checking for any crepitus, gurgling, and I'm not feeling anything. All right, you can lay back for me. All right, so with your sternal border here, your sternal border is located right here in your tricuspid area. I don't know if I told you that, but that's where it's located, okay? Then you have your sternum, okay? You have the apex of your heart, and you have your epigastric area, all right? And also you have your axilla over here, all right? So now what we're gonna do, we're gonna measure your heart, okay? So I'm gonna tap on you a little bit. We'll start right here where your PMI is located, the fifth intercostal space. Okay, look like our sound stop right here. All right, let's do the fourth one. Okay, stop right here. Let's stop right in there. And then our second intercostal space, okay?
Okay.
Okay. Right in there. All right. Then we'll check this side over here. We'll get you to lift this side, your breast up on this side. Right, stop right in there. Okay, so what we would do, we would measure this. Okay, measure those areas. Okay, you can put your hands down. So as far as your lungs are concerned, it sounds like you have good lung sounds. Your quality is good. Your duration is good. Your intensity is good. Everything looks like it's within normal limits. Like I said, I didn't hear any wheezing or any stridor, any advantageous sounds at all. So, do you have any questions for me?
No, ma'am.
Okay. Thank you for allowing me to do your examination, Mr. Harris.